Part 38, Activating Emergency Medical Services, EMS, for Children. Welcome to the lesson on Activating Emergency Medical Services EMS for Children. In this video, we will discuss the steps to call 999/EMS when attending to ill or injured children. Activating EMS for Children. Step 1. Always make sure that the scene is safe when approaching a child. Step 2. Tap the child's shoulders and ask them if they are okay. If they don't respond, they are considered unresponsive. Immediately yell for help and send somebody to call 999/EMS and to get an AED. Step 3. After determining that the child is unresponsive, check their breathing. If they are barely breathing or only gasping, begin CPR. Gasping may be forceful or weak, but it is generally ineffective. This is abnormal and often occurs during cardiac arrest. Step 4. If you are alone, and must leave the child to activate EMS, give 5 sets of 30 compressions and 2 breaths, about 2 minutes. Before leaving the child, call 999/EMS. This concludes our lesson on Activating Emergency Medical Services EMS for Children. Next we will review choking in children.